So I've had several people ask me recently, can you reverse type 2 diabetes? Can you put type 2 diabetes into remission? Can you cure type 2 diabetes? The answer is that many people can absolutely achieve remission of type 2 diabetes. Now, you'll sometimes hear healthcare professionals use the word remission instead of saying cure. Part of that is because if you've had type 2 diabetes, that diagnosis often remains in your medical record. This is for billing, insurance, and kind of long-term monitoring purposes. But whatever term you want to use, the important question is this: can your blood sugar return to normal levels without diabetes medications? For many people, yes, absolutely, it can. Remission is typically defined as maintaining an A1C below the diabetes range without diabetes medications for at least several months. Over my nearly almost 20 years of working with people who have chronic metabolic conditions, I've seen many people achieve this, but it does take work. So the longer your blood sugar has been elevated and the more damage that's occurred, the harder it can be to reverse things. That doesn't mean it's hopeless. It simply means the process may take a little longer. It may require more intervention. The good news is, though, that your body is always trying to move toward health. There is almost always something you can do to improve your metabolic function, improve your blood sugar control, reduce your risk of complications. And no, starting a medication does not automatically mean you'll be on it forever. I've had many patients over the years tell me they didn't want to start on insulin or another medication because they thought or they heard it was going to be a lifetime commitment. Like once it starts, you're never going to be able to stop it. That's not always true. Sometimes medications can be used as a bridge. I'd like you to think of them as being used as a bridge while you're making the lifestyle changes needed to improve your metabolic health, address the root cause. But you do have to put in the work. That means the walking for 10 minutes after meals, getting movement first thing in the morning fasted, getting that sunlight on your eyes, building muscles through resistance training, addressing your sleep quality, getting evaluated for sleep apnea possibly, managing your stress, prioritizing the morning sunlight, evening sunsets to support your circadian rhythm. It means changing what you've been eating for, oftentimes for many years. So for a lot of people, that means dramatically reducing processed foods, sugary foods, refined carbohydrates. It may mean focusing on protein, healthy fats, non-starchy vegetables, and little to no whole food only carbohydrates. This might be what you need while your body heals. One tool I personally like, as you know, is spending time in nutritional ketosis because it really can help lower your glucose, lower your insulin, support your metabolic health. None of these things are magic on their own, but together they can be incredibly powerful. The question isn't whether type 2 diabetes can improve. The question is, are you willing to do the things required to improve it? So if you have type 2 diabetes today, what's the first lifestyle change you'd be willing to make? Let me know in the comments and follow for more conversations about your metabolic health, insulin resistance, helping your body function the way it was designed to. Any sort of support that you might need, feel free to drop a comment with a question. I will do my best to reach out and help you. You can head on over to my website, lyndsycarlson.com. You can reach out on the contact form there. I do have several offerings as well if you need something like that. But I hope you have a blessed